you're just joining the webinar, we're just going to give people a couple minutes to join. So just hang for a few minutes and we'll get started. We'll get started in about 1 minute. Okay, it is 2 o'clock. I'm going to get us started because I know you all have other things to do today. Thank you very much for joining us. I'm Karen Bentham, the Executive Director at Oasis. We're thrilled here to have Stephanie and Marina from GreenShield Canada presenting today. We have over 200 people that have registered for this webinar, which is tremendous. So we're really excited to have such a great turnout. It may mean if you have questions, they might not all be addressed today during the webinar, but no problem if you either think of things afterwards or your question didn't get addressed today, you can certainly reach out to your benefits administrator at Oasis and they can get you the answers to those questions. I've had the honor of being part of GreenShield's Client Council, which just was last week. It's an annual event. So I've had a bit of a deep dive into this new platform that GreenShield is launching, that we are going to be launching at Oasis on June the 19th. And I have to say it is very impressive and I'm really excited about it. I think that you're going to really like what GreenShield has put together. I think it's going to make it a lot easier for employees to navigate through the website and figure out what they need and how to get what they need. And I think it's a huge improvement from where we've come from, and GreenShield continues to innovate and get creative. So well done, GreenShield. We are really excited about this, and I'm going to turn it over to Stephanie and Marina to walk you through the changes.
Great. Thank you so much, Karen, for that great introduction. So here's our agenda for today. We'll talk a bit about GreenShield and our exciting new platform, GreenShield Plus, as well as give a demo. And then we'll look at the GreenShield Plus Help Center and give you a short summary of some of the important things to remember about the upcoming change and some questions at the end. Okay, so I'm sure most of you are already familiar with GreenShield, but I'll just tell you a bit about how we started and who we are. So we were founded in 1957 by William Wilkinson. He was a pharmacist who witnessed a mother sacrifice her health by foregoing her own medication so that she can afford a prescription for her sick daughter. So driven by the purpose to find a better way, he did take matter into his own hands and introduced North America's first prepaid drug plan. And GreenShield was born as a not-for-profit health benefits provider that we reinvest our earnings back into to champion better health for all. Okay, so our values haven't changed since then, and fast forward to today, we're still Canada's only national not-for-profit benefit carrier and the fourth largest benefits provider in Canada, servicing 6+ million Canadians with over 1 billion claims transactions processed. So being not-for-profit means that we invest back into GreenShield and also give back to help build healthier communities. And our mission is to make it easier for Canadians to live their healthiest lives. And currently, some of our initiatives include, through GreenShield Cares, include improving oral health with our Green Door project, where we've partnered with the University of Toronto Faculty of Dentistry to provide life-changing dental care to underserviced communities, our women's mental health program, and we're also piloting an essential medicines program that provides access to eligible Canadians without access to provincial programs or group benefit plans, the drugs that they need to meet their priority healthcare needs. So it is our goal to invest $75 million in social impact and positively impact over 1 million lives by 2025. So we are also proudly Canadian and operate coast to coast with over 1,400 employees across the country and 5,000 clinicians. So when you access the plan member portal today, you would be used to seeing GreenShield everywhere to access your benefits, to check eligibility, see claims history, as well as submit claims. But we are migrating to our new plan member portal, GreenShield Plus, on June 19th. So as of June 19th, it will now look like this. With a fresh look, you'll also be able to do the same things, as well as much more with our new GreenShield Plus portal. And with our new portal, there will be better access, better convenience, better integration, as well as better health outcomes. So with our new look and platform, some of the great digital services that you know and love have also gone through a rebranding recently. So here are some of the new names for the services that haven't changed. So Maple will now be called Telemedicine by GreenShield Health. Inkblot Employee Assistance Program will be Employee Assistance Program by GreenShield Health. The Health Depot Pharmacy will be the GreenShield Pharmacy, and Tranquility by GreenShield will now be Digital CBT by GreenShield Health. So in fact, with GreenShield Plus, you'll be able to access these services even easier, and you won't have to visit several web pages or use multiple logins. So I'll show you how to access these shortly through our demo. Okay, you'll be able to access GreenShield Plus on June 19th on our corporate homepage by clicking the Sign In button and then clicking on GreenShield Plus Member Sign In, or by going directly to app.greenshieldplus.ca. And for app users, you will need to download the new GreenShield Plus app for your first time on the Apple App Store or Google Play Store. Okay, so we'll do a demo now so you can take a quick sneak peek of GreenShield Plus. Okay, when we first go to the web page, this is what the new platform will look like and how you'll sign in. So for existing users who have used GSC Everywhere before, you will use the same email and password that you use to access GSC Everywhere today in order to sign into GreenShield Plus. New users will still have to sign up. So this is a demo account, so the information you see today will look a little bit different than what you see when you log on June 19th. Good, so here is the main page once we signed in so that you can see what the new portal will look like. In the green box at the top, you'll see things that you might find useful to see and do. So as you engage more with the portal, the recommendations in this green box will also be more customized based on your activity. If we scroll further down, these are the available health services and tiles that we'll see. This is what's available to you, and these services might be covered through your plan, but even if they're not, as a GreenShield plan member, you will receive preferred rates. Further down, we can see the recent claims that we made, and we're also able to view all of our claims, submit a claim, check coverage, find a provider, and also download personalized claim forms. And if we scroll further down, there are some additional services that you'll have access to through our health ecosystem, such as great eyewear discounts through our partnership with KITS, virtual physiotherapy, personalized fitness programs, and more. If there is an additional cost to access these, it will also show you once you click on the tiles. So if we go back to the top, we can click our name at the top, and this is where we can access our ID card. And we can access this faster than before. And if we go to our account settings, we can also access your account information. This is where you can see your profile, look at your coverage. And this is also where we can put our banking information for direct deposit to get our money back faster. Next, we'll take a look at how we can check coverage. So if we go to the menu at the top and claims and benefits, and we click on check coverage, we can search for the service that we're looking for, or we can use one of the pre-populated ones in the boxes below. Your current booklet will also be posted here. So if you need additional information that's more in-depth, you can always access your booklet on the side. So let's check coverage for massage. The number of steps required is shown on the left side, and then we'll fill out some of the information that's required. So who the claim is for, the duration, as well as the amount. So we'll say $100, and then we can click continue to estimate. It'll show us the amount the plan pays and then what we have to pay out of pocket. There's also additional details below, such as your benefit start year, what the copay is, and there's also a handy bar here where you can easily visualize and see how much coverage you used to date, as well as what the remaining balance of coverage is for the rest of the year. If you clicked on drug instead of massage, we can take a look to see the drug coverage available. We can enter the drug name or DIN number and then click search to see if it's covered under the plan. So in this example, Ozempic requires prior authorization. So we can click on the dose required, view details to see additional information. And if there's a form that we need to fill out, we can access it and print it right there. So at the doctor's office, we can ask them to fill it out so that there's no delay and no additional visits required. Next, we'll take a look at how to submit a claim. So you can do it from the top menu, or you can hit submit a claim through the submit a claim button, and you can submit a claim in a few easy steps. So there's progress on the side, and you enter the type of claim. So massage. If you use this provider before, it will show up again. So you can quickly pick the previous provider that you used, or you can search for a new provider. Then you would enter the claim details. So who the claim is for, and answer some basic questions like if there's coverage through another benefits plan. And you can enter the details of your claim, such as the date, the type of service, as well as the amount. Next, you would review all the information that you entered to make sure that it's accurate, and then hit the legal disclaimer. And then you would hit submit. And this is where you can also view your claims history. So you can also access claims history through the dashboard or through the main page. If you scroll down, you can see what your recent claims are, like I showed you before, and you can hit view all claims. Here you'll see all of the claims submitted, and they are color coded, so you can quickly see which claims have been processed and which ones will require attention. So you can click on the claim and you can see additional details of the claim, as well as view your explanation of benefits in the view statement section here. If your claim was denied, you can click on it to see the reason for the denial. And if you have any additional documents that you need to provide for your claim, you can attach them here. And if you want to ask a question, you can do that too by clicking Ask a Question. And once you do that, all of the details of the claim are pre-populated for you. So the date, the claim form number, so you don't have to enter it yourself. And then you can enter your question. And our call center agents will have all the necessary information to assist you without having you remember any of the dates or do anything additional. You can hit submit, and then it's submitted, and you'll get a response shortly. Okay, next we're going to look at the available health services that are integrated with GreenShield Plus. So you don't need to visit another web page or sign in with another account to access the services. So using the telemedicine tile, We can conveniently see a general practitioner through our partnership with Maple by booking a consultation without physically going to the doctor and sitting in a waiting room. So if this is covered by your plan, you can see what's available here. But you can still use the service even if it's not covered by your plan. You'll just be directed to pay with a credit card at the end. So you can choose who the visit is for. Then select the specialty, so in this case, general practitioner, and we would choose as soon as possible. We would then indicate the symptoms and the details of visit, and then you'll be placed in queue to see a general practitioner. And you can do that via message chat, where you can upload pictures and speak to the doctor in chat, or you can do that in video form as well. And at the end, your doctor can provide you with a prescription, which can then be ordered for pickup through the GreenShield pharmacy, through pickup at your local pharmacy, or delivery with the GreenShield pharmacy. Okay, and if you want to access the GreenShield pharmacy directly, we can also do this through the pharmacy tile here. You can add a new prescription or transfer a prescription from an existing prescription from another pharmacy. It's very easy just to do that. You can then choose who it's for. Then you can upload the prescription very quickly. Choose where it should be shipped to, which would be free. And then if there is payment, because there is a portion not covered by your plan, then you can enter your credit card, select your credit card information as well. Okay, so GreenShield Pharmacy provides free delivery within Canada with a low dispensing fee of $7.99 in Ontario and $9.99 in other provinces. So next we're going to look at the counseling tile, where you can access mental health services easily. This will work with the mental health services coverage available through your group benefits plan to direct bill. And if you do have access to the employee assistance program through your benefits, the number of sponsored hours for counseling will show here as well. So finding a mental health professional can be quite daunting, but if you click with match with a counselor, you can find someone who matches your criteria by just answering a few questions. The left bar will show our progress. And before we begin, there is a reminder that if there's a crisis, we can get immediate assistance by calling this phone number, or to call 911 if there's immediate danger. So we can start with a well-being assessment and indicate how we're feeling on a scale of 1 to 10. And then there's self-evaluation. So an example of the questions it'll ask, it will be like, in the past 2 weeks, how often did you feel that you had nothing to look forward to? Then you would indicate the answer. Then next, you can answer some questions about our diagnosis from the past, as well as stressors. Then we can choose counselor preferences. Those would be things like language, and there is a large variety of languages that we can choose from, like Bosnian, Cantonese, Dutch, Farsi, etc. And once we choose our language, we can then choose a specialty that we would prefer that our counselor have. And if we have any religious or spirituality preferences, we can also indicate them here. And then we can indicate our general availability, Monday to Friday, Saturday, Sunday, day or evening. And then once we do that, we're shown a list of matches of counselors that match our criteria. Okay, and if we click on that, we can view a profile of the counselor and their bio, as well as their picture. And then when we hit match, we can verify our number and then schedule an appointment. The first 15 minutes of the appointment is free to ensure that you've made the right choice, but you can always go back to your matches and choose another counselor if after the 15 minutes you don't feel that connection. If your plan has access to the Employee Assistance Program, all of the great features like health coaching, life transitions, financial, as well as legal advice can be accessed through the Work, Health, and Life Services tile that you see here. And Change for Life, our wellness portal, where you can fill out a health risk assessment to prioritize your health journey, as well as read articles about medical conditions, use trackers for steps, blood pressure, etc., can also be accessed in this well-being tile. So that concludes our demo. We saw better access and better convenience with everything now in one place and at your fingertips, as well as better integration without having to navigate several websites as well as different username and passwords. And for sure, we'll see better health outcomes since everything is now interconnected. And all of the great features I showed you in the demo will be the same on the new GreenShield Plus app, as there is feature parity. So this is a great way to have your digital ID card handy at all times. And if you're at the doctor's office, that drug lookup tool I showed you earlier is really handy because you can instantly see if a drug is covered or if an additional form is required, so you can get it filled without another visit or call to the doctor's office. So again, to access GreenShield Plus on your mobile device, you will need to remember to download the new GreenShield Plus app, and you'll be able to sign in starting June 19th. We also have a great new GreenShield Plus Help Center. So while you're on GreenShield Plus, and if you need some additional assistance, there are a number of articles you can access with the support button at any time at the top right corner. For the first time, you'll be able to see great articles like Getting Started on GreenShield Plus. Those are about your first steps, creating accounts, navigating the dashboard, and if you're looking to check eligibility, submit a claims, kind of like what I showed you earlier, you can access that through insurance and benefits. And if you have any questions about any of the other services that I showed you, like mental health, pharmacy, telemedicine, or well-being, you can click on these options as well for some additional articles and videos to watch. Here are just a few reminders. So the first, GreenShield Plus will be available June 19th. You can visit greenshield.ca to sign in with the GreenShield Plus member sign-in button. You can download the new GreenShield Plus app. Your email address and password is the same as before. There is a GreenShield Plus Help Center available when you click support. So if you need some self-serve assistance, you can click on those articles. And the last is we have a new phone number at 1-888-525-7587 that you can contact us. If you press 1, you can go to our call center for insurance-related matters in regards to claims, eligibility like normal. But if you have any questions with any of the extra services like mental health, counseling, EAP, you can hit the 2 option and someone will be able to assist you. So this concludes our GreenShield Plus demo, and I hope you're as excited about this new experience as we are, and we're happy to answer any general questions you might have. But if you do have specific questions related to your claims or personal details of your benefits plan, due to privacy, we do encourage you to contact our customer contact center for assistance.
Thank you, Stephanie. That was terrific. Lots of good information. I see one of the questions is, will we be providing a recording of this session to participants? And yes, we will. So that will be made available on our website, and we'll also share it in our monthly newsletter. So it will be available for you to share with anybody that couldn't join today. Any other questions for Stephanie or Marina? Well, you must have done a great job then. You covered all the
I
key
think
We
points.
have a question.
there is a question.
Oh, great.
Yeah.
Sorry, go ahead.
Yeah, I'm wondering, like, I missed a couple of first minutes at the beginning. So is all the information, like our direct deposit information, our providers that we were using, automatically all transferred to the new platform, or do we have to re-enter everything?
No, it should be transferred automatically.
Perfect, thank you.
That's the right answer, right?
May I ask a question, please?
Of
Yes,
course.
go ahead.
Yeah, you know what? It's when I trying to call GreenShield Canada, it's this system of voice recognition, and there is no possibility like without it. Is it really necessary to have this voice recognition system? So it's just not sometimes don't feel comfortable with it. Maybe to push the buttons could be available too, or how you think?
I think
So-
you can just indicate English and it should direct you to an agent if your inquiry is not one of the pre-filled prompts that come up. So you can speak to an agent and there is voice password, but if you have that already, you can speak to the agent and they can also let you know how to remove that if you're already using password voice password.
Remove what? Sorry, I don't understand. To
So
remove.
we do have a voice password feature where you can
Yes,
use your
yes, it
voice.
says yes.
So if once you've already like activated it and you don't like it, you can speak with our agents and they can direct you how to remove that.
Ah, okay,
Yeah.
got it. Thank you, thank you. And
Great.
another question. It's for me, it seems like GreenShield Canada always first denied your claim, and only after the lot of time spent in processing, attaching documents, the claim could be processed. Why is that?
There may be some additional information that's required to submit your claim. So what we do suggest is sometimes before you do submit that claim or use that service to call our customer contact center so they could tell you beforehand if there is anything special required, like an extra form or what's available or what providers that you can see. They can help you and provide you with that information so that your claim isn't denied when you go get that service.
Additionally, OASIS benefits administrators can help if you want to call our office. They can often, because they are on the site all the time, they're very well versed in it, and they can help you with any of those issues.
Okay, thank you.
You're welcome. Any other questions out there? Okay, well, good timing. We had 5 minutes left in the session, and Stephanie, you did a great job of covering everything. So thank you for that. Thank you, Marina, for being here today too from GreenShield. And thank you to our 150 participants out there. It was great to have such a good turnout. As I said, we will share this recording so that you can use it in future. And we're looking forward to the launch on June the 19th. Any questions that you might think of after this ends in a minute, you can certainly reach out to OASIS and we can get answers for you. So thank you very much for your attendance today and for making time for this. We really appreciate you joining and wishing you a great rest of your day. Thank you, everybody.
Thank you.
Thank you.
Thank you.
Bye-bye.
Thank you.